All right, guys, we're back. Bumper going on. Gonna talk telemedicine today. Make sure you guys see Aladdin. Aladdin was excellent. You ain't never had a friend like me. Gotta see Aladdin. It was very well done. Will Smith crushed it. Okay. Bumper going on. All right, guys, we are back on the Dr. Daliah show. Thank you all for tuning in. 1-877-DOC-DALI, 1-877-DOC-DALI. Okay, so telemedicine is a big topic these days, and I think the writing's on the wall. We are seeing primary care doctors like myself becoming replaced. And this concept of seeing a doctor online and getting a prescription is just being gobbled up by patients. They love it. I do telemedicine now. I see patients on online, and I took care of a patient who was actually driving in his car. I'm like, pull over, man. He's driving, and I'm like, I can't examine you that way. But people love the idea of being able to, just have that access to a doctor. I mean, you know how nice it would be to contact a lawyer and only have to pay like $20 or $40 and then get legal advice, and it'd be like really, really good advice and actually save me hundreds of thousands of dollars, And so telemedicine is now probably one of the most popular modes of medicine. It's just, we're training a bunch of people to go into internal medicine and family medicine, and there's almost going to be like two separate specialties. Now, as a doctor, I'm a family medicine doctor. I know a lot of people don't believe me. Yeah, I did. I got my MD at University of Nevada School of Medicine. I also did training at UCLA. Shout out to UCLA. And then I trained in Las Vegas. I know people don't think I'm a doctor. No, you know what? Okay, I'll show you. You guys can't picture me, doctor-eyes. I could doctor. Okay, so like when I take care of a patient, like a telemedicine patient, okay, I don't talk, like when I get excited, I talk really high, and I'm like, oh my God, Dee! Okay, I don't do that. I don't do that with my patients. Usually when I get into, doctor mode, serious, telemedicine mode, I'm like, hi. My name is, I don't know how to do that. They go, hi, I'm Dr. Daliah Wachs. See, I almost accent. Sometimes I'll speak in a British accent because people think that British people are awfully intelligent, and I might do a British accent. Or Australian, Take your Viagra, mate. I think Australian accents are really, really cool. Israeli, but you drink and smoke? That's so stupid. It makes no sense. It's so unhealthy. Oh, you're so stupid. Don't even do. And so I'll play around with accents sometimes, but usually it's like, hi, I'm Dr. Daliah Wachs. I am a board certified family medicine physician, and I'm here to help you. Dee! No, I could be all doctorly. Hey, I know how to doctor. I've done a lot of years taking care of thousands, maybe millions of patients. I could do my thing. But so with telemedicine, what I'm noticing has ended up happening is when somebody has a cold or a shingles outbreak or a cold sore or a rash or a vaginitis, they are able to go to multiple different telemedicine platforms that we have out there now, where you get to actually see a doctor or you get to talk to them on the phone, and they evaluate you and they decide if this is something they want to treat over the phone, call in a prescription, or if they need to refer you out or have you go to an urgent care or see your primary doctor. We do not do controlled substances on most of these platforms. I don't think any platforms allow controlled substances. Won't do ADD medication, won't do Viagra. Won't do muscle relaxants. Those are controlled substances. But I am noticing that the average person is starting to get grumpy. We've talked about this. If they don't get their blood pressure medicine, if they don't get their diabetes medicine. And when I respond, well, we need to see, your blood pressure readings. We need to see your sugars. People go, well, here's my labs. And I'm starting to see this new world of medicine where people can do their blood work by themselves, upload their results. Our cell phones are able to do a lot medically. We're going to be able to later put this little tab into our charger of our iPhone, pee on it, and do a urinalysis. I mean, we bring our phone, don't say ooh, we bring our phones to the bathroom all the time already. I mean, they already have, probably every single strain of E. coli on it to begin with. So we're going to be able to pee on our phones or spit or do our blood test, our finger stick, and submit it onto our phone and upload it to a doctor. But see, here's the thing. When I had my practice, in family medicine, people would come in, some of them would, be train wrecks. They would have like tons of things going on with them, or they'd have a car accident or this major neurological disorder. But then you would have a UTI, a bladder infection come in, or an STI, or, counsel on this. And now that we're seeing a lot of those patients move over to telemedicine, more severe cases are going to be going to family medicine and internal medicine. And so rather than the primary care front line, they're going to be now the second line. They're going to be the tanks. Now, a lot of people don't go into primary care to be tanks. They want to be, foot soldiers, right? They want to be there, boots to the ground. They want to be, right there on the front line. But a lot of those cases are now going to telemedicine. And so we're going to have to start teaching medical students and, teaching in schools medicine a little differently, because if the average patient is going to want an evaluation two-dimensionally, is it two-dimensional on the phone or one-dimensional? It's two-dimensional as opposed to 3D. Okay, I don't understand what 4D is. People go, it's 4D. Like, what the hell is 4D? Anyway, so 4D is like, I think, in real person. So maybe I know this isn't 3D. If this is 3D, I mean, my nose would be like totally knocking your coffee off your table. But anyway, so medicine is going to be completely different. We need to now, as doctors, be expected to identify your rash. I was taught to identify a rash. You feel it. You press on it to see if it blanches. Sometimes smell a lesion. You know how many things I've smelled? Because certain things have a smell. Strep has a smell. I know you have strep throat a mile away in Walmart. I could tell what aisle somebody with strep throat is in because I could smell them, right? Because it has a smell. And so we learn how to use our other senses to examine somebody. Now you're going to lose that through computers. And so medical schools are now going to need to step it up and teach medical students how to diagnose through a telemedicine platform. I don't know if I like the way that's going, but all I know is it is giving a lot of people access to care who didn't have care. And I think this is where medicine and primary care is going. 1-877-Daliah, don't go away.